Hi, please could you explain who you are and your job role?
Yes, hello Katie. So I'm Hara, and I've been a doctor for 34 years and a consultant psychiatrist for 25 years. And during that time, I've really worked in community learning disabilities services. And my new role is as National Clinical Director for Learning Disabilities with NHS England. And what that means is providing clinical advice and clinical support and leadership to NHS England. And of course, NHS England has the Learning Disabilities programme, as well as dealing with the Transforming Care agenda for people with learning disabilities and autism or both.
Okay. So what do you think is important to work on within the Learning Disability programme?
Well, I think key to it is going to be real active listening and engagement with people with learning disabilities, really so that we can begin to tackle the massive health inequalities that exist for people with learning disabilities. And by that I mean that there are lots of delays in diagnosis and treatment that we know of from research. And we also know that there is a lot of avoidable, unnecessary deaths, premature deaths of people with learning disabilities. So I think tackling those is going to be big key issues for me.
Yeah. Thank you. So what would you like to see change for people with a learning disability?
Well, I think from looking at the research, we know that people with learning disabilities tend to live with a number of long-term conditions which affect their health. And that means physical health as well as mental health problems. So what I'd like to see is a much more integrated approach so that we begin to look at the person as a whole and treat the person as a whole and give that support that's required. And by doing that, we're going to improve, I believe, the health outcomes of people with learning disabilities. So why, for example, should somebody with learning disabilities who's admitted into hospital stay in hospital longer than somebody without for exactly the same condition? We should be having the same outcomes, the same quality of care, the same experiences, and I think that's crucial. And part of that is ensuring that clinicians and practitioners value the person with learning disabilities, sees behind the disability, so they can understand what's happening, really understand experiences and value those experiences and that feedback. And I know that from working with medical students, for example, that really in order to change practice, we need to change attitudes. And so by exposing them, by introducing them to people with learning disabilities at a much earlier stage in their training, I think it would make a massive impact in terms of changing attitudes and valuing people with learning disabilities.
Great, thank you for your time.
Thank you very much.